Hey guys, my name is Dr. Hannah Webb and I'm a naturopathic physician here on Salt Spring Island, BC. I'm going to give you a little overview about how I see what I do. I'm a naturopathic doctor, which to me means that I'm the bridge between the world of conventional medicine and the world of holistic, alternative, complementary medicine because I use the tools of both. On the conventional side, I do physical exams, I can make a diagnosis, I do conventional lab tests, so that is similar to what your regular medical doctor would do. On the other side of things, some of the primary tools I use in my practice are nutrition, which can look like dietary changes, what is a healthy lifestyle, specific therapeutic diets, or gut healing protocols, which I do often. I also use a lot of botanical medicine in my practice. I do acupuncture and look at things from a traditional Chinese medicine perspective. I also do high-dose vitamin mineral IVs for people who are really depleted and need their resources being built up. And I also do some mind-body therapies, and I'm trained in chiropractic techniques as well. So, that's the whole spectrum of what I have to offer. And with any one patient, I probably won't use all of those things, but that just gives you an idea of what I can do. And then beyond the fact that I have a different set of tools from what your regular medical doctor would have, I'm also trained to think in a different way. And so my goal is to ask questions about all different aspects of your health. My initial visit is 75 minutes long, so that gives us plenty of time to go deeply into your health picture and ask everything from tell me more about your main concern, but also I'd like to learn about how your digestive function is, how's your sleep, how's your sense of community, do you spend time in nature, what are your menses like if you have a menses? And so I'm really getting a sense of you as a whole system so that I can see, okay, so if the system got out of balance in some way, how do we bring it back into balance? And I really look at, okay, what can we do to address the main concern, but also how do we support your system's vitality overall by making sure that those fundamental building blocks of health are in place. So that's sleep and healthy digestion and assimilation of nutrients, managing stress. And if all those things are in place, your whole system is going to feel better overall, and that's going to support healing in your specific main concern. And then I also look at all the different organ functions. So I'm looking at your digestive system, how's that doing? I'm thinking about your liver, how's that doing? Your kidneys, your adrenal function, and if any of those particular organ systems need support, your lungs perhaps. So that gives you a bit of an idea of my philosophical approach. And really the goal of all these things is to go, okay, is there a way we can get at the root cause of what's going on for you? So symptomatic treatments are appropriate and helpful, absolutely, at times. And how can we reel things back and go, okay, what happened here? Well, how did this balance come into start showing symptoms? And is there a way we can treat this from a really upstream place? That's my goal. I also really like to say I work collaboratively with my patients, and so what that means to me is I want to know how it's going as we go, because whether we're talking about a drug intervention, a herb, a specific therapeutic diet, no one thing is good for everyone. And so we can work together to figure out what's going to be the right healing tools for you. And I can bring the pieces of what is evidence-based, what has been researched, what's in the literature, what is their traditional use behind, especially as it pertains to things like herbs and traditional Chinese medicine, where there's thousands of years of history of use of those things. So there's a certain type of evidence that we can glean from that. My clinical experience, I bring that as well. What have I seen? And then you are the expert on your body. And so you get to say what's working, what's feeling good, what's not working, what you're able to incorporate into your lifestyle, what you're struggling with. And together we can come up with a much stronger plan and strategy, because we can work together to go, okay, troubleshoot, this is not working, what else can we do? And because I have such a broad set of tools, I always have so many ideas. There's always some other approach that we can try. So my goal is to be really empowering for my patients, to help support them in their journey, and for us to be health allies and working together. Yeah, I think that's everything I have to say. Thank you. If you have any questions, please feel free to reach out. I do 15-minute complimentary meet and greets, and so if you would like to find out if the condition that you have is something that I work with, just test the water, see if we would be a good fit, feel free to reach out, and I'd love to chat with you.